record today's webinar. And as of this moment, the webinar will record. It will record until we have completed the webinar, and then we'll make it available to you and to everyone else that may want to view it through the community webpage. We will talk about that again a little bit later. All right, thank you for coming. I see that we're up to 17 participants, and let's get started with the first topic, eligibility. And at this point, I will hand it over to Allie. Welcome, Allie.
Yep, thank you, Evelyn. So I understand that a lot of the information contained in probably the first few slides here is information that everybody's seen before. I know that there are several community events we do out in the field, that some training sessions, things like that, that you've probably seen most of this from. So we'll run through it relatively quickly just so that we can get to kind of some of the meat of the presentation, and we'll bring Dan in as well to make some comments from the Medicaid HUSKY side for us, and we're hoping that we'll get some nice, robust discussion going later with questions. So we're going to start with who's eligible for a qualified health plan, and again, this kind of focuses mainly on our plans that are sold through Access Health Connecticut. They are available to all Connecticut residents who are either American citizens by birth or naturalization, or are lawfully present and intend to be for the entire plan year. And just a reminder that lawfully present residents, they have a valid current U.S. immigration status and are not imprisoned. And we're going to get a little bit more into the concept of being lawfully present versus being a lawful permanent resident later on in the presentation. And again, you've probably seen this list a bunch of times, who has eligible immigration status. And, you know, we also understand that there are a lot of intricacies that go along with each of these statuses. There could be a number of different codes and letters and numbers that go along with them. So we're going to try to kind of drill down into some detail about some of those eligible immigration statuses and lawful presence and permanent residency. So in previous webinars, we've commented a lot on families that are at mixed statuses. So some members of families may have a valid immigration status. Some families may have undocumented members who are not eligible for coverage, but that doesn't preclude members of the family who do have qualifying statuses from applying. And they can use the same application for premium tax credits and cost sharing reductions as they would for other eligible members of the household who might be eligible for our HUSKY program in Connecticut. Those who are not applying for health coverage for themselves won't be asked about their immigration status, and no one in the family can be denied coverage. Anyone who has a qualifying status can't be denied because they have a family member or a household member who's not applying. And we understand, we see this a lot coming through, and we just want to make sure that everyone understands that there's no reporting that comes out of our system to the federal government about undocumented non-citizens. And I know that in the beginning of the Affordable Care Act, there was some concern about reporting individuals and families who did not have qualifying status. So, you know, we just want to restate that fact that no one can be necessarily denied coverage by that, and no one's status is being reported out from our system as well. We do have a number of undocumented immigrants or non-citizens that come through our system and are not eligible to obtain health coverage. And I just want to make it clear that when we refer to undocumented immigrants, it's those without any status here in the United States. So this could also be referring to individuals who perhaps had a valid status at one point and have either overstayed on that status or it has expired since they arrived. These individuals are exempt from the individual shared responsibility requirement or the tax penalty when they file their taxes with the IRS, but they don't have the opportunity to, and that's because they don't have the opportunity to apply for coverage. So, you know, we understand we have a map here of community health centers throughout the state where they are able to go seek out services, but not health coverage. So we'll go through some tips and resources.
Dan, you have something to add?
Yeah, I'd just like to jump in and share with you a quick tidbit of information in relation to the number of undocumented immigrants living in Connecticut. And this is not undocumented that have received Medicaid or any type of medical assistance. It's the number of undocumented living in the state. It was, as of February 2017, according to the Connecticut Post, at 130,000. So it's quite a significant number. I believe and this is off the cuff, so I believe our state population is at about 3.6 million or just shy thereof. Mm-hmm. So percentage-wise, it's certainly a substantial number.
Good, great point. Thank you so much. All right, so we're going to talk about enrollment tips and resources.
Yep. So if we go to the first slide there, we've got our open enrollment dates for qualified health plans through Access Health Connecticut. They have shortened the open enrollment period for this year. That came through regulation earlier in 2017 and was finalized by the federal government. Healthcare.gov, the federal exchange, their open enrollment runs through December 15th. But in Connecticut, we had the ability to extend that through December 22nd. We're happy that we could get through the extra week. We understand that it's a very busy time for people and wanted to give them just a little extra time to enroll. And I just actually want to mention, and I know this is probably going through Dan's head, that for those who qualify for Medicaid, they can come onto our system and apply at any time, not just during open enrollment.
Good point.
And here's just a list of our resources that we have online, on the phone and in person. This year we do have a little bit of a switch up for our in-person help. We have those 10 enrollment locations and 5 enrollment fairs. I believe they're every Saturday throughout open enrollment, most Saturdays throughout open enrollment. And brokers and certified application counselors are available all year round to provide assistance. And all of that assistance from Access Health and our partners is free. We do also offer assistance in multiple languages, and when anyone visits our website, the full application to enroll and the Learn More site are also available in Spanish. Our call center as well has a service to provide assistance in over 110 languages, just so that we can accommodate anyone that comes through. And our brokers and certified application counselors, those across the state, provide assistance in many languages as well. So when individuals begin the application process, we do want to make sure that not only with immigration information, but income information, information about birth dates and social security numbers, identity, things like that, we want to make sure that people understand that coming to the application equipped with all of that information is important. Because starting an application and not finishing it can make things difficult to get the most accurate information out of the system. Being able to kind of go from the beginning to the end with all of that information is very important. So even if a field is labeled optional, entering all of the information that you have will make the process go a little bit faster and ensure that eligibility determination is as accurate as possible. And it will help prevent our consumers and clients from needing to verify information later on, which we know a very high percentage of individuals who interact with our system inevitably do have to verify information. So they have to send in that proof. And we just recommend that consumers be prepared with all of their relevant immigration documents before starting their application. And I'm not going to read through all of these, but we do have a list here of the documents that that consumers will need to enroll, and the numbers that are requested from these documents that go into our system. So you can kind of click through those. There's a few slides here that have that information on them. As I said before, if you're not equipped with all of that information, or the information that a consumer attests to in the application doesn't match up with information that we get from our trusted federal data sources, we will open a verification for that individual. We call it a verification checklist, or a VCL item. where individuals have 90 days to prove their information before any action will be taken on their account. And since their immigration status can impact their eligibility for certain types of programs, we do have to open up that period of time so that they can prove their eligibility to participate in those programs. So we do encourage people to read eligibility notices, and we know that there are a lot of them, that they read them through as carefully as possible, and to please reach out to us if there are any questions about what's contained in the notice. And here you just have some information that restates what I was touching upon before earlier about disclosure of immigration status. The application will only ask for information that's needed to determine your eligibility, and disclosing any information like a social security number for a person not seeking coverage must be voluntary and will only be used in our system to determine eligibility for an applicant or a beneficiary. So it doesn't impact the individual who is not requesting coverage, but it may be requested if the individual who's not requesting coverage is a member of the household. And again, individuals cannot be denied coverage because of a family member or a household member who's not applying and hasn't attested to their immigration status.
Dan?
Yeah, just before we leave the subject of Social Security numbers, I wanted to share that for immigrants and non-immigrants, if they're not authorized to work in the U.S., they can still receive a Social Security number if they need one in order to apply for government benefits. Additionally, if a non-citizen, i.e. an immigrant, needs an SSN to be claimed as a tax dependent, they can be issued a individual taxpayer identification number. ITIN is the acronym, instead of an SSN. ITNs are 9-digit numbers and look like SSNs, but do not allow the individual to work. So on occasion, we will come across the student number, is it CIVIS?
Yes.
And the ITIN, the SSN, they're all kind of intermingled at points in time, depending on individual statuses and their citizenship, non-citizenship affiliation. Just wanted to share that.
Yeah, and actually that's a very good point, because I believe it was earlier this year, the Access Health application was enhanced with the ability to accept an ITIN. So we do have that capability now. I know that some people may have run into that previously, that they did not have an SSN, but did have that tax filing identification number. So we are able to accept that information when determining tax filing status.
Perfect.
Terrific. On to the next slide.
Yeah. So we're going to talk through 4 points that kind of typically come up for us between Dan and myself. We'll kind of talk to these undocumented pregnant women and some of the options that they have here in Connecticut. We're going to talk a little bit about the designation between lawful presence and lawful permanent residency. Recently, we've had quite a number of hurricanes and natural disasters, so individuals coming from Puerto Rico and the U.S. Virgin Islands to Connecticut seeking, what's the word I'm looking for? Not necessarily asylee, that's not the right word, but coming to Connecticut to live here either with family members or with people that they know because they've had to be evacuated from their homes, and then also deferred action for childhood arrival or DACA. So I just want to level set with everyone before we kind of dive into this topic that we understand that you and all of our CACs and our other community partners have and continue to have a number of questions and even some case-specific scenarios about presumptive eligibility for undocumented pregnant women or people of other circumstance. And I just want to be clear that when we go into this topic, we are trying to provide a resource here and a general reference for people, and that if there are case-specific questions and scenarios that you've run into, people that are running up against some challenges, they can feel free to contact Dan, and his contact information is on this slide here. So I'll just run through this quickly, and then Dan, I'll have you kind of supplement where you see fit. So at our community conference, we did have this question come up, and again, I want to be clear that we're trying to serve as resource here, and that this what's listed here may not apply to every individual who is an undocumented pregnant woman, but in Connecticut, we do have emergency Medicaid for the provision of labor and delivery services for undocumented pregnant women. They can complete applications for this coverage. I think it's a two-part process, if I'm understanding correctly, and it can be completed by hospital staff using the Connect system. The application can only be processed after labor and delivery services have been delivered. And then at the bottom there's a little information about using the Access Health Connecticut application form, and then sending it to the expedited HUSKY fax line that's listed there. And Dan, I'll turn it over to you to supplement if there's anything that I haven't covered there, or anything anybody should know.
Fine job.
Thank you.
Allie. Well, I'll just kind of step back and give a broader definition of undocumented immigrants, and then I'll kind of close out the loop and tie back in with the undocumented moms. As we mentioned earlier, there's 130,000 individuals, not all on Medicaid, but I do know that there's a significant number of undocumented moms, especially down in the southern part of the state and some of the areas in our bordering states in New York and Rhode Island and Mass. So let me start off with this. I'll state that an easy definition of an undocumented immigrant is that the individual is a foreign-born person who doesn't have a legal right to be or remain in the U.S. Some are border crossers, and by border crossers, I think we're all in understanding of, if you're living in Texas, perhaps, or Arizona, some of those southwestern states, certainly you may encounter border crossers. Someone would have to take a giant leap across the Great Atlantic or the Pacific to reach Connecticut as a border crosser. However, certainly we can receive a border crosser who crossed a long time ago and somehow matriculated up to the Northeast. But for the most part, an undocumented individual will have been admitted into the country, into the U.S., in a immigrant, or probably in all likelihood it would be in a non-immigrant status, such as a visitor's visa or a student visa, tourist visa, work visa, etc. And that individual would be approved by immigration services for a duration of stay. And if they were to extend that stay beyond the approved time frame without an adjustment of their status and remained in this country on our terra firma, they would be here as an undocumented illegal. So even though the person may have some documents in hand when they present at a local office, it doesn't necessarily mean that at that point in time they're a lawfully present, lawfully residing, qualified non-citizen. They may indeed be here as an undocumented, even though they do hold some type of verification of a previous status that they had achieved. So tying in with the pregnant woman portion, certainly as Ellie has made mention of, the labor and delivery is covered. In addition to that, miscarriages are also covered. That does not require any type of post-approval by our partner Colonial Care Cooperative. It's, if at any point in time a DSS staff person asks that you submit that information, so we need to forward it to our colonial team for review. That would be a misstatement. Once again, miscarriages are, I'll use the term automatically approved, kind of tied in with that labor and delivery. Certainly there's no postpartum care for these individuals. Qualified non-citizen, someone who is here in an immigrant status, has a green card, even if they were here less than 5 years, certainly could receive the 60 months post-delivery, postpartum coverage. But for this undocumented group, they would not qualify for that. And I think the other, do we have, I haven't looked at the slide since this morning. Do we have something about the emergency portion of undocumented?
We not as it relates to anything other than pregnant women.
I think just as before we leave this undocumented pregnant women slide, if I may, I'd just like to kind of place a short definition on emergency medical coverage. So in order for a person to be approved for emergency medical, so let's say it's an undocumented who had a baby, was covered for their labor and delivery, came off of assistance, certainly, and perhaps 6 months later took ill and presented in the ER with a serious illness, they may indeed qualify for, we'll call it regular emergency medical coverage. And that would require the following: that the individual's health is placed in serious jeopardy, or there would be serious impairment to bodily functions, or there would be a serious dysfunction of any bodily organ or part. So it's kind of a three-pronged approach that's taken by the feds on this. And an interesting note is that, let's say someone was very ill and required emergency medical assistance, in the sense that perhaps they needed an organ transplant, and it fell under that criteria. An interesting tidbit of information is that care and services related to an organ transplant are not included in emergency coverage. So I think that just kind of underscores the point of emphasis in this whole webinar / conference call, in the sense that there's a lot of gray area in a lot of this undocumented immigrant, non-immigrant population when you tie in certainly the Affordable Care Act and Medicaid and the immigrant statuses along the way. So if that led us into the next screen, hope it did. Okay.
It does.
Terrific. Thank you, Dan.
So just on the heels of that, we know that there is a difference between the term lawful presence and lawful permanent residency, and Dan mentioned it a few times during that description. And we just want to be clear that when our system bars an individual from being eligible for Medicaid or HUSKY because of the 5-year bar, they're referring to the individual has not had a lawful permanent resident status for 5 years. So oftentimes what we run into is individuals who have a qualified immigration status that would allow them to be eligible for a qualified health plan. And with financial help through tax credits or cost sharing reductions. And they state that they've had this status for 10 years. And that they don't understand why, and oftentimes for a while we didn't understand why they were being barred from receiving a HUSKY or a Medicaid determination. But the difference is that a lawful permanent resident, so an individual who has a lawful permanent resident card or a green card, who has been present and at that lawful permanent resident status for 5 years will qualify for Medicaid. So anything that is not either an LPR card or a green card doesn't constitute that lawful permanent resident status. But for qualified health plans, most of the other statuses that we've talked about in this presentation, so earlier in some of those lists, they would qualify to purchase a QHP through Access Health. So we just wanted to make that distinction so that you have it here for reference, that when an individual sees a verification item for their 5-year lawful presence, it may very well have to do with that they have not been lawful permanent residents for 5 years rather than just lawfully present.
That's well put, Allie.
Thank you.
If I may, I'd just like to kind of tighten up any misunderstandings in relation to the lawfully present component of this entire process. And I think that if you follow along with what I'm about to say, it should make some sense. I will preface anything I'm about to say with the fact that as a 32-year DSS employee, I can honestly state that the entire non-citizen eligibility process is one of the most difficult that the department encounters on a daily basis. It's a very, very fluid, ever-changing world that we live in relation to the Medicaid world and the ACA world, and certainly the immigration world. So we share the angst and at times the confusion. It's a very, very common theme, I think, across the board and across our state and across our country. So that being said, I'll kind of try to tighten this loop up on the lawfully present. One of the complexities of non-citizen eligibility for the Affordable Care Act indeed stems from the difficulty of defining who is considered lawfully present. The regulations implementing the Affordable Care Act define lawfully present to include immigrants, non-immigrants, asylees, refugees, and most other non-citizens who are known to the U.S. government and have been given some type of permission to remain in the U.S. Now, certainly, just to underscore the difference between an immigrant and a non-immigrant, as an example, is an immigrant would have a green card. They would hold that green card and would be present, lawfully present, as a legally permanent resident. A non-immigrant, for example, would hold a visa, perhaps a work visa or a student visa, which would allow them to remain in the U.S. for a definable period of time until, for instance, if they were here on a student visa, until their studies were completed. Once again, that's how at times it circles back to those individuals becoming undocumented. When they overstay those visas and they kind of fall off the radar, they are indeed present in the country, but they're not lawfully present. So to underscore, it goes without saying that this is indeed an often fluid and dynamic existence between all of these moving parts. And I guess we're going to touch on the DACA, the young folks, which is a very sad situation indeed. But that's another prime example of how this ever-changing world that we're living in is affecting some young hopefuls, certainly.
Dan, if I can, for a moment, ask you a quick question before we move on to the next subject. Is the information, especially that which refers to the emergency Medicaid eligibility, is any of that detailed information available on the DSS website? Is there a place where people can also look to?
It is, but it may be on a very high level. I think for the folks, and I'm guessing, I hope I have some of my friends and colleagues out there, some of my friends that I've visited with in the past. I think that as far as detailed information, I don't believe that the department has something at the ready on our homepage or any type of link from that.
Okay.
But that's certainly something I'll circle back with. The worst thing, I guess, is that I don't want to bombard anyone with all of this information and just make it a bit more muddled than it need be.
Of course.
So what I could do is perhaps I could send some things that the department uses and us policy consultants use to kind of help us navigate the waters through this very, very difficult to understand
Got it. Wonderful.
world we live in. I will like to also touch on, I do know that there's a residency requirement. So that we talk about lawful presence, but in addition to that, in order to get any type of Medicaid or any of your product line, Allie, you certainly have to be a Connecticut resident. But that's a self-declared thing. It used to be with the department that oftentimes we'd make people get their rent receipts and their leases and notes from family members to verify that they're indeed living here. But as it is self-declared, we're not as stringent as we used to be. But a residency requirement is met as follows. Individuals are residents of the state in which they intend to reside indefinitely or work in. There is no durational residency requirement. So there should be no one telling anyone that they need to reside in the state of Connecticut for 30 days or 60 days or 90 days. If you set foot in Connecticut and you state that you're a resident, for all intents and purposes, you are a resident. But there's always a but. I will close with this. There are at times, once again, to kind of loop in with our bordering states, at times we'll encounter a situation where an individual has a residential and or a mailing address that differs, and perhaps the mailing address is out of state. So the individual has a residential address, for example, in Stamford, and they have a mailing address in Yonkers, New York. In those instances, our DSS staff is always to red flag those type cases and delve into those a bit more, because what we don't want people to do is double dip, and it's very important that they do, at that point in time, establish their Connecticut residency. But that's far and few between.
Perfect. All right, let's move on to the DACA recipients.
Yep. So this is another topic that I know that we've talked about a lot, but it does come up for people. And I want to make sure that everyone knows that DACA stands for Deferred Action for Childhood Arrival. And unfortunately, this does not qualify individuals with the status for a qualified health plan or for HUSKY coverage through Access Health Connecticut. So when they come through our system and attest to that immigration status, it will not yield an eligibility determination. The status was created as a part of the DREAM Act that was passed by President Obama in 2012. And it provides 2 years of deferment from deportation actions and eligibility for a work permit. So it does cover a lot of positive, it does give a lot of positive reinforcement for individuals who came to the United States under those circumstances, in the sense that they are able to work and they are also able to apply for another status, and so that they can remain in the United States for longer as perhaps a permanent resident. They are at the DACA status exempt from the individual mandate or the tax penalty, and they'll not have to pay back a penalty for not having coverage. They can apply for the exemption through the IRS, and they use Form 8965 to do so. I don't remember the category of exemption off the top of my head, but I do know that we've gotten questions from members from hospitals, some community health centers about what options do these individuals have. And, we are obviously always looking out for new opportunities for people, connecting with new resources and things like that. So, as we get that information out, we will surely be sharing that if we do find anything or if anything changes in the future.
And if I could jump in, thank you, Ali. Just a few more tidbits to share with the group. Interesting enough that there's a $495 filing fee for these folks to file for an extended 2-year stay, to reapply for this program's protection. So that's an interesting piece. And as of September 4th, according to the USCIS, in the state of Connecticut, there were 3,800 DACA recipients. So once again, those numbers are out there. I mean, they do pale in comparison to the undocumented, which I believe I stated at 130,000. Yeah. But once again, it's not 38, it's 3,800. Mm-hmm. And in the U.S., I'll close out with this, there's actually 690,000 DACA young folks. So, and the fluidity of that situation continues. I guess there was an October 5th deadline for those people, the folks that were due for reconsideration, and I don't have the exact time frame, but I believe it was perhaps from October through March, October of 17 through March of 18, that they had to furnish their renewal forms by October 5th. And I guess there was a hiccup with the U.S. Postal Service, and it's created some havoc along the way. But,
So just to kind of wrap up some of our challenges, and I know I want to leave some time to go through some questions, but hopefully we've covered a lot of them in the content of these conversations. So we understand that there are a lot of individuals, evacuees and displaced persons that are coming to Connecticut as a result of the hurricane tragedies that are going on. And we just want to let everyone know that in terms of, aside from any information about their immigration status or anything like that, because they are considered citizens, these individuals can come to Access Health to apply for coverage. They will qualify for a special enrollment period, or if they are filling out their application and are eligible for HUSKY, will be able to enroll that way. They do fall under an exceptional circumstance special enrollment period, and they may also apply for 2018 coverage as well, since we are in an open enrollment period. If they don't have their SSN, because what we're hearing is that individuals lost everything in this tragedy, so they don't have their Social Security card, they don't have any proof of their identity or their income or anything like that. So we just want to let everyone know that they can select the option, and this is right in the application that they're applying for an SSN. And they do have some options to go to local SSA, Social Security Administration offices to obtain a temporary card and kind of get that they will help them get things back in order. And our call center has been equipped to handle these individuals, whether it's a CAC that calls on their behalf or whether they call us directly. And we have been working closely with the department to just kind of make sure that we know what options are available for individuals and that they can get the coverage that they need while they're here.
Just to piggyback on what Ali just mentioned, certainly the department from the commissioner and medical director on down to our frontline staff view all of the clients we serve as very, very important individuals that we need to help. But certainly these folks coming up from our U.S. territories, USVI, St. Thomas, St. Croix, St. John, and Puerto Rico, it has been the directive from the commissioner and his team that We stand at the ready to assist these folks as best as we can and as expeditiously as we can. And certainly we do have some leverage in regards to the way we need to deal with CMS, i.e. the feds, in how Medicaid billing and the like will be handled. So the fact is, the territory that these people originate from, if they were indeed on some form of Medicaid coverage, that coverage, I'm not going to state definitively, but it should be extended to cover any care that they receive. And if it doesn't get covered by the territory that they originated from, it would certainly be, the gap would be closed out by having them qualify here in Connecticut. We're ready, able, and willing to work with not only the U.S. territories affected by this horrible disaster, but in addition to the folks, we're also working directly with the federal government to ensure that these people are served and served timely. And I will say this to the folks on the call, because it's such an important item, if any of you encounter any issues whatsoever in facilitating or trying to get these people what is reasonable and timely assistance, I kindly ask that you reach out to myself, and I will share it not only with my policy team, but I will also share it with the department's leadership. It is something that we're quite concerned about. And that's how I'll close on that topic.
Terrific.
Thank you, Dan.
Well, thank you. Thank you, both of you, for this very helpful information. I have a part of the rest of the webinar that, because I said at the beginning that we want to make sure that we have a good conversation with the participants today, I really want to get to the question and answer session. So I'm just going to talk very quickly about why Access Health Connecticut is so interested in partnership opportunities with agencies across the state and groups across the state. We have been working at establishing partnerships with community groups such as the ones that you see here in the slide. And these are folks and agencies and groups that agree to share information about Access Health to the people that they serve. I see some of the categories of our community partners right now. Here is a wonderful depiction of the majority of where we've been able to locate community partners that we work with, that we provide information to, and that they also pass on the information to the clients that they serve. What partner engagement means to us, I want you to understand a couple of key points. We want this to be a two-way street by which, as a community partner, you are able to pass on the information and engage the people that you serve, but also that you receive from us information that is helpful to you and services that are helpful to you. We can staff at your events. We can have speaking engagements that we provide information with that you may be sponsoring. And we also have, very important to us, and I'm hoping that you take a moment to check this out, the community website, which the address is learn.accesshealthct.com/community. Please, when you have a moment, go to that website and look at all of the resources that we have put out to be able to help you in your job in serving those in your community. Other examples in which you can help Access Health Connecticut is you can display information that we can provide for you. You can display brochures and hand out brochures, again, that we also provide and distribute across the state. You can send email to your memberships, and you can also, and we encourage people to do this a lot, link to Access Health Connecticut from your website, or share Access Health Connecticut's social media post. If you go to that website that I mentioned, the learn.accesshealthct.com/community, you will be able to see some examples of how we can do that. You should know that Access Health Connecticut has now for a couple of years attended naturalization ceremonies on a regular basis. We know that people who are becoming new citizens are not only excited about the fact that they have achieved that, but they have family members and friends and neighbors who may be in need of health insurance coverage. So we use that as a wonderful opportunity to put out more information. Now, ways in which we can engage your community, I mentioned before, speaking engagements. We go to events such as fairs and festivals. We provide educational webinars for partners, such as the one you're participating in right now. And we distribute informational materials, research and surveys, and we also hold planning sessions. How you can contact the outreach group, the outreach team for Access Health Connecticut, the easiest way to do it is by emailing us at this email address that you see on your slide. It's outreach@accesshealthct.com, or in the community partner website, which I've already mentioned. You can also fill out a form that will give us information. You can ask for a speaker. You can suggest an event that we should cover, information, an exchange of information such as that. Resources, I mentioned the community website. Right now, the second one that I have here is because we're already obviously in open enrollment. In-person help is very important, and you can find out the closest location of certified application counselors that provide one-on-one help for enrollment at support.accesshealthct.com. We publish a monthly newsletter, and we, of course, hold these educational webinars. Other resources, here we go. Here are some of the upcoming webinars. Again, at the community page, you can see the schedule as well, but note that we have some interesting topics coming up. This is a screenshot of the ways in which you can communicate with us, that we can contact us. But again, remember that the community website, I can't repeat it enough times, is learn.accesshealthct.com/community. That is where you will find a tremendous number of resources that will be helpful to you. And so I encourage you to become a community partner. I already shared the email address that you can contact us with, outreach@accesshealthct.com. You can also call this number, 860-327-5517. That number will take you directly to the outreach team for Access Health Connecticut. Go to the community website, and of course, follow us as Access Health CT on social media. All right, the point where I really wanted to get is the question and answer session. We do have someone already asking, will these slides be made available? We are happy to share the slides after the webinar to the participants. And as I mentioned before, the recording of the whole webinar will be made available through the community website. Let me ask a couple of questions that we have had participants share with us. For clarity, are undocumented children who are minors covered by any medical? Are these the DACA children? Ali?
So, and I know that Dan gave us a great definition of undocumented. So, unfortunately, it's not easy to clarify based on the question, because if they are DACA children, they would have received that status upon arriving in the United States. So they either are they either do have the DACA status, or they may have some other status. So just because you are an undocumented child that comes into the United States, you may not have the DACA status. So I just want to make that clear. I don't know if that helps necessarily, but I think Dan, if you want to add to that as well.
I think they're two distinctly different groups, and really. The undocumented folks that we're predominantly dealing with in Connecticut, kind of to circle back to it, is those individuals that came to the U.S. in a non-immigrant avenue, such as a tourist or student or visitor or work visa, and exceeded their approved duration of stay. They extended their stay beyond the time that USCIS had approved them originally for. And I guess if it's a child and they're undocumented, it would circle back to an emergency coverage type scenario.
Very good. Let me ask another question that is asked of us also for clarity purposes. One of our participants wants to know the pregnant women and children here with LPR status, the lawfully present resident status, but that are here less than 5 years, are they covered by HUSKY?
As we say, if otherwise eligible, they do qualify for HUSKY. So short answer is yes. Yes, yes, yes. Pregnant women and children that are here in an immigrant status, for example, a green card holder, do indeed qualify. They do not have to meet the 5-year bar.
Great. How's this for the next question? Are people with SU6 green card code victim of criminal activity eligible for HUSKY without waiting the 5-year period?
Those individuals, and I will preface my statement by saying this, without having the case specifics or the intricacies of the situation at hand, I will speak in a general sense, but for the most part, a U visa holder, as described, would not qualify until they have indeed met the 5-year bar. Now, a U visa holder holds a valid non-immigrant status and are lawfully present in the U.S., but they're not meeting that definition of an immigrant. Now, I guess I'll stop there. I don't want to extend my statement for. I don't want to confuse anyone, including myself.
Understood. Yes, yes. No, we understand absolutely. I have a couple more questions that I want to share with both of you as presenters. But first, let me take a little point of personal privilege and interject and point everyone to the chat box where our friend Grace has posted a link to a survey. The reason why we're posting this link is because we want to encourage you to tell us what you thought of today's webinar. So I'm going to ask you, please, 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 before the webinar ends, click on that link and go through the short survey that will ask you a couple of questions. Your feedback is very important to us. All right, a couple more questions. We asked about the green card category already. Someone wants to know, what are the acceptable forms of documentation for children without citizenship or green card status?
Okay, well, once again, speaking in the general sense, let's assuming that the child is a non-immigrant. Maybe they're a derivative of their mother's status on a visitor's visa or a work visa. I'm sorry, they're asking about the
document types.
Document types?
The types of documents.
Yep.
To prove so we would be looking at their visa, is that, or their birth? Was there made?
Yeah, so I mean, typically,
what was the exact question? I'm sorry.
I can kind of speak generally about this. I mean, one of the things that we ask for often, especially if an individual doesn't know exactly what their immigration status is, or if they've arrived in the United States, is an unexpired foreign visa, for example, with their I-94 record.
Right.
So that's kind of one that we see often. We know that anyone that made an arrival within a certain period of time will have that record available. And that record also, the I-94, I believe, also includes a date, an allowable date through which they're present. So if we have that information, and I just want to make a point about our notices. So I do know that on some of our notices, it says that an unexpired foreign passport will satisfy the document requirement. That in and of itself does not. So it would have to be the unexpired foreign passport and the I-94 record. So I just want to make that clear. That's an update that we have to go in and make to our system. I think that we put foreign passport in there because we know that it is a portion of the acceptable documents, but it is the unexpired foreign passport and the I-94 record together. Yep.
Great. Thank you, Ali. Yeah, go ahead.
I'm sorry. If I may, there's some great automated access to various federal government agencies that enables the client and or the assister or whomever is assisting the client. And I'll share those with Ali.
Yeah, that would be great.
And the team. I've got about 3 or 4 direct links that can hopefully expedite some of these inquiries into a client's status.
Sure.
Excellent. That would be really helpful. Great. Terrific. Let me ask one more question that I've seen in the field before, especially when there are mixed status families. Someone is asking us, must the applicants disclose if others in the household are here without documentation?
Well, on the Medicaid side of the equation, once again, they're always linked in the sense that in looking at an immigrant/non-immigrant family and tying in with the ACA and Magi Medicaid and a Magi household construct, right? The way we build the house, depending on the tax filing status of the individuals that are applying and the individuals that reside. So we would have to look at the Magi household to determine whether or not we need information. But I believe if the person's not applying for a benefit, I believe that may have been the question, if they're not applying.
I believe so, correct.
Then I believe we wouldn't necessarily need that information.
Yeah, it doesn't. The application is not considered, it's considered complete even if an individual is not requesting coverage and then does not disclose their information. So they can be listed as a member of the household, but in terms of their immigration status, they wouldn't necessarily need to put in that information.
Beautiful.
I guess I was kind of going on an offshoot where if it was undocumented with perhaps some qualified non-citizens and perhaps a citizen, a mixed household, so to speak. There may be some individuals don't have to provide us with that information, others that may indeed have to. So,
terrific.
Okay,
well, with that, I would like to once again call everyone's attention to the link that Grace posted. Please look at your chat box and click on the SurveyMonkey link that we provided you there and take a couple of minutes to give us your feedback. With this, I think that we have reached the amount of time we had allotted for today's webinar. So I want to give a special thank you to Ali and to Dan for being here and providing this very important information. Please remember that you can contact the outreach team of Access Health Connecticut by emailing us at outreach@accesshealthct.com. I know that people have asked before, how can we partner with you? How can we work together? That is the first point of contact for you to reach us, and we will follow up and look for ways in which we can help each other. So with that, again, I want to thank all of the participants. I really appreciate Access Health Connecticut appreciates you taking the time to learn about today's important subject. Don't forget to click on the SurveyMonkey link. And with that, we will say goodbye and thank you once again.